If you've been told that your only option for arthritis is surgery, it's definitely time to take a step back. While surgery is sometimes necessary, it's important to note that some arthritis cases can be managed, even significantly improved, without going under the knife. Most people just don't know where to start. Now, in this video, I'm going to walk you through a complete strategy to reduce pain, preserve joint function, and improve your quality of life, all without surgery. And the most important tip, well, that's the last one, and it's something most doctors never even bring up. So let's begin with this. What is arthritis really? Arthritis isn't just wear and tear. The two most common types are, number one, osteoarthritis, or OA. This is degenerative wear and tear related arthritis, or inflammation in the joint. And the second one is rheumatoid arthritis, or RA, and this is an autoimmune process. Most non-surgical treatments focus on reducing inflammation, preserving mobility, slowing or reversing joint degeneration, and supporting whole body function. Let's begin with the foundation of managing arthritis: inflammation control. Let's start with anti-inflammatory diet. Here we want to focus on whole foods and things rich in omega-3 fatty acids like salmon, sardines. Also look at leafy greens, berries, olive oil. And let's avoid inflammatory triggers like processed foods, refined sugar, seed oils, and alcohol. On the other hand, consider incorporating turmeric, which contains curcumin, and ginger, both having anti-inflammatory effects. Then there are some supplements worth considering. Omega-3 fatty acids with EPA and DHA, which reduce joint stiffness, especially in rheumatoid arthritis. Then there's vitamin D, which supports immune modulation and bone health, and glucosamine and chondroitin. There's mixed data on this, but they may help with symptomatic relief in some osteoarthritis cases. Always discuss supplements with your physician before taking any. Here's another key concept to remember. Movement is medicine. Begin with low-impact exercises like walking, cycling, and swimming. We talk about this in a lot of my videos. They help maintain joint lubrication, improve flexibility, and reduce stiffness. It builds muscle to offload joints, which reduces strain on cartilage and that inflammatory response that it leads to. Next is physical therapy. Customized programs can correct joint mechanics, improve posture, prevent further damage. A good physical therapy program, or PT program, is often the single best non-surgical investment you can make in your health and in your joint wellness. I'm currently undergoing PT myself for a minor rotator cuff injury that comes from the work that I do, and I can personally attest to the value of this process. But let me just tell you right now, make no mistake about it. This is not a massage session. It means work, effort, and in many cases, a fair amount of discomfort in order to heal, repair, and restore injured tissues so that you can regain full strength, function, and range of motion. So there's definitely work that needs to go into that. And let me also tell you from my own personal experience, it doesn't all happen just in the physical therapy center. They're going to give you exercises, they're going to give you homework, they're going to give you things that you need to do to be a good advocate for your own recovery, health, and wellness. So PT is a great thing, but you've got to put the effort in. Take it from me, I know. Never estimate the power of stretching and joint mobility. Gentle range of motion exercises keep joints moving and prevent contractures. Contractures are where the soft tissues begin to bind and give you that locked in or frozen process. It's something you definitely want to avoid in all of your joints. Now let's discuss some medical interventions which are short of surgery. First, there are NSAIDs, non-steroidal anti-inflammatory drugs, and other topical treatments as well. Over-the-counter options like ibuprofen or topical diclofenac or Voltaren can reduce localized pain, but use these only as needed and only as long as needed. NSAIDs especially. Long-term NSAID use can harm the kidneys or the lining of the stomach. So make sure you're communicating with your doctor about the dosage you're taking, the frequency with which you're taking them, and especially if you're considering long-term use. Next are hyaluronic acid injections. You've probably heard a lot about this. This is for knee osteoarthritis particularly. These are joint lubrication injections, and they've been shown to reduce pain in mild to moderate osteoarthritis. Then come corticosteroid injections. This can give temporary relief for flare-ups, but should not be used too frequently due to cartilage breakdown. There's definitely a risk that this anti-inflammatory therapy can have serious side effects. Finally, let's discuss platelet-rich plasma, or what we call PRP therapy. In this technique, we use the patient's own blood to spin it down and extract certain factors. And these growth factors then stimulate repair by injecting them back into the joint area. Some data supports PRP for knee osteoarthritis, and I definitely suggest you discuss this option with your orthopedic surgeon or a regenerative sports medicine doctor if you're really having a lot of problem with the joints and other things have failed. Now let's dive into a really interesting area, what I think is an under-talked area of strategies. Number one is weight management. I think this is a really interesting statistic. For every 1 pound of weight that you lose, there will be a 4-pound pressure reduction on your knees. Losing just 10% of your body weight can significantly reduce arthritis pain. Number two, sleep and stress reduction. Again, we talk about this in many of my videos for many chronic illnesses. Chronic stress and poor sleep increase systemic inflammation, making arthritis worse. Useful techniques include mindfulness, sleep hygiene, magnesium, and light therapy. Finally, we have the so-called mind-body connection, what we know as the psychosomatic response. Now, I just want to say at the outset here, the psychosomatic response in some cases means that there's a false or fake association between a treatment and how the patient does. So for example, you might be doing a study looking at the treatment of high blood pressure, and one group of patients gets the actual medication that's being tested and the other group gets a sugar pill. Well, you'll find that a small number of people getting the so-called placebo or sugar pill will actually have a reduction in blood pressure. That's called a psychosomatic response because the patient believes that the medication will make them better and the body reacts like that. So that's called the placebo effect or a psychosomatic effect. But not all psychosomatic effects are quote unquote not real. Psyche, the mind, is connected to soma, the body. And we know that this is a very strong, real, and powerful connection. So some studies have shown that techniques like Tai Chi, yoga, and meditation reduce arthritis pain and improve mobility. There is a powerful connection between the mind and the body. So in summary, let's recap the non-surgical toolkit. It starts with the anti-inflammatory diet, targeted supplements, low-impact movement and physical therapy, injections if needed, including hyaluronic acid, PRP, or steroids. Then we have weight loss, sleep and stress management, mind-body support like Tai Chi, or gentle yoga. Now remember, surgery is a tool, but for many people, the real solution lies in consistency, strategy, and understanding the root cause of joint damage. Always see a highly qualified orthopedic surgeon if you feel that you really have tried all of these processes and nothing's working for you anymore. As I said, I am a surgeon and I believe in surgery, but surgery has to be retained and administered in the right situations for the right patient. Please subscribe for more evidence-based, no-nonsense strategies to stay strong, independent, and pain-free as you age. Please stay tuned for the next video.